3. Measurement of blood pressure. The required supplies include a sphygmomanometer, stethoscope, notebook, and pen. The caregiver should dress neatly and wash hands thoroughly. The elderly person is in a stable emotional state. No exercise within the past half hour. Verify the elderly person's bed number and name. Communicate and explain the purpose of the procedure. Positioning. If the elderly person is in a supine position, the arm should be positioned at the same level as the heart. If the elderly person is in a sitting position, align the brachial artery with the fourth rib. In supine position, the arm should be at the mid-axillary line. Roll up the sleeve to expose the arm, palm facing upward. Elbow straight. Sphygmomanometer preparation. First, turn on the power switch. Place it vertically. Then open the mercury reservoir valve. Then wrap the sphygmomanometer cuff around the elderly person's upper arm. Expel all air from the cuff. Wrap it flat around the middle of the upper arm. The lower edge should be 2 to 3 centimeters above the antecubital fossa. Snug enough to allow insertion of one finger. Then inflate. Palpate the brachial artery. Place the chest piece of the stethoscope at the most prominent brachial artery pulse site. Hold the stethoscope in place with one hand. Hold the pressurized balloon in the other hand. Close the valve. Inflate the cuff steadily until brachial pulse disappears. Then inflate an additional 20 to 30 millimeters of mercury. Deflate. Deflate slowly. The mercury column should descend at 4 millimeters of mercury per second. Note changes in the mercury column scale and brachial artery sounds. Identify the first court cough sound heard through the stethoscope, which corresponds to the systolic pressure reading. This is the systolic blood pressure. When the pulsation suddenly weakens or disappears, the mercury column reading at this point is the diastolic pressure. After the measurement, fully deflate the cuff. Close the pressure valve. Return it to the storage case. Tilt the sphygmomanometer to the right. Allow all mercury to flow back into the reservoir. Close the mercury reservoir switch. Close the case lid securely. Store it properly. Assist the elderly person to a comfortable position. Record the readings. Systolic and diastolic blood pressure in mmHg. EG 110/85 mmHg represents the systolic and diastolic blood pressure values. Measuring blood pressure. Precautions for measuring blood pressure include 1. Regularly inspect and calibrate the sphygmomanometer. Check and calibrate the sphygmomanometer regularly. For long-term blood pressure monitoring, follow the 4 fixed principles: fixed time, fixed site, fixed position, and fixed sphygmomanometer. If blood pressure sounds are indistinct or abnormal, repeat the measurement immediately. When repeating, fully deflate the cuff to 0. Wait for a while and then measure again. For elderly with hemiplegia, measure on the unaffected arm. If two consecutive readings differ by more than 5 mm of mercury, perform a third measurement. Record the average of the 3 readings. Evaluation. Evaluate the feelings of the elderly. During the operation, the elderly person experiences no discomfort. The environment is clean and tidy. Supplies are handled appropriately. This concludes the instruction on vital signs measurement. Thank you.